Medicine is always a team sport. Critical care more so is a really important part of that. I will say, and everybody knows this, that I have probably the best job at the medical center. My name is Amika Panu. I'm the program director for the Anesthesia Critical Care Fellowship. We have a very strong fellowship program. It's a one-year ACGME accredited program that is then extended to 2 years for our emergency medicine and dual candidates who choose to do a second fellowship with us.
And the strength of our critical care program is that we are intimately involved at all levels of the hospital with regards to the care of the critically ill patients and at many different types of patients, from neuroscience, cardiac surgery, general surgery, thoracic surgery.
If you're interested in research, if you have an academic bent, or you're interested in the quality improvement initiatives, or you're interested in management of critical care units, all of that can be accomplished kind of hand in hand with your clinical training in the year with us.
I knew that I wanted to do critical care training after my anesthesiology residency, and I was really drawn to the educational mission of the BI critical care program.
Something that the division and the department has prioritized is making sure that we can individualize what people want out of their training.
I do a lot of research. That's part of my big career trajectory, and so I've been taking advantage of elective time both to work on existing projects and then build new research collaborations here at BI, which is really exciting. We can rotate with nephrology, infectious disease, any clinical areas that we just want more experience with, so that's been really valuable.
The strengths of our critical care fellowship are that we, again, have a very broad range of patient population that you get exposed to during the fellowship. In addition, we have extremely strong didactics and ultrasound training. And so I think our fellows, through achieving a very hands-on and well-rounded critical care education, are well prepared for critical care practice at many different settings.
We have a broad curriculum that brings in education from many different people involved in kind of the critical care space. They're amazing. They're just overall very generous with teaching, very easygoing, very easy to talk to and bounce ideas off of. I never feel like there's a barrier to asking for help or asking questions. And they have a lot of respect for us. They really get to know us on an individual level and really help us balance what would be best in terms of autonomy versus supervision.
Critical Care Fellowship is also designed to train leaders within the hospital that really are integral to the medical center, especially an academic medical center.
I always say it's the fellows. We've been very lucky to really recruit some of the brightest minds, and more so than that, some of the best doctors I've ever worked with into the fellowship over the years.
They very thoughtfully balance fellow autonomy and a service-driven mission where we're really in charge of managing teams. And then they really balance that with protecting our didactic time and making time to educate us explicitly. And I think that that makes us feel really valued and also really balances the in-the-moment, feet on the ground exposure that we get to clinical care and decision-making with investment in us as learners as well.
I think recognizing some of that and sort of being part of a team that works well is what's important and what's made this a good place to work. We're not the kind of program that sort of rests on laurels. The program's been around for a while. It would be easy to take it easy, and we don't. Education is valued, hard work is valued, and understanding that each person is valued. And I think all of that has really helped us make this program what it is today.